On today's episode, I'm sharing some lessons learned about staying focused on the community win. You're listening to the PHEC podcast, episode 369. The field of public health is so broad, overlapping multiple industries. With epidemiology at the core of public health, there are an unlimited number of ways to target specific populations, health conditions, environmental issues, and causes that matter most to you. My name is Dr. Huntley, and I'm the host here on the Public Health Epidemiology Conversations podcast. I'm an epidemiologist, consultant, and entrepreneur with over 20 years of experience in healthcare and public health. On this podcast, my guests and I engage in conversations that demonstrate the importance of public health and epidemiology across a variety of industries, helping you think outside the box and inspire greater positive impact in communities around the world. Now, let's dive into the topic of this brand new episode. Greetings, everyone, and thank you for joining me on this episode. On today's episode, I'm sharing some lessons learned from working with one of my clients not too long ago, and it's about staying focused on the community win. In fact, this actually is over a long period of time, but I'll share details in just a moment. In case you're relatively new to the podcast or you're not really familiar with what I do in terms of my work in public health, I lead a public health and epidemiology consulting firm that supports large nonprofit organizations and some government agencies that serve Black, Indigenous, and people of color, also known as BIPOC communities. We help our clients communicate their health data and information in plain language to the communities they serve. So this can sometimes look very different from client to client because sometimes the communities they're serving are those departments within an organization, and sometimes it's the individuals within the communities themselves outside of the organization. If your organization serves BIPOC communities, then please reach out to us through our website, which is DrCHHuntley.com. We would be happy to meet with you and explore how we might be able to support you and your organization as well. Links to our website will also be provided in the show notes for this episode. Now, staying focused on the community win is kind of the theme of this message or my key takeaway from all of this. But I'd like to just share a story with you that got me kind of thinking about this and making it top of mind. And I think this is, my thoughts around sharing this is that we are a diverse community of public health professionals. And whether you are a student or early career professional or wherever you're working within the public health industry, these are some important reminders and ways to stay focused and keep us moving forward with enthusiasm and that passion for what we do. We are, as a workforce, we've suffered a lot of losses. We've lost a lot of our workforce over the last few years. And I think those of us who decide and make the decision to stay and serve in this space, this is a way of a little bit of reinforcement. We need to support each other, remind each other of the reasons we're here, and sharing, kind of this message and takeaway. Not only does it, these are really top of mind for myself and my team as we recently, kind of gone through this, but I know a lot of you go through these same cycles and patterns. And I think sometimes we cycle through them too quickly. We don't pause long enough to really absorb and reflect. And I'm hoping that this will encourage you to do so. So with any project that we're planning, especially those that take a long time, there are so many challenges that can hinder the process. So this particular client project that I'm referring to in this story example, this project expanded a little over a year. And we are just a couple of months away from really tying things up with the final pieces all put together and kind of closing out this project. So it's been going on for a very long time, and you can relate to these, right? You've had these projects that take a very long time to see it through. You may have come into a project that was already in progress. Maybe you started on, your job and this project, someone else had started the project and you inherited the project. Or you may have started it from the very beginning and you have gone through, several months, close to a year, give or take, and seen it through on the other end. So this is kind of what I'm talking about, these long-term projects. I think that the number of challenges we can face with long-term projects like this are just, there's so many of them that it's hard to count, and you can almost get used to the interruptions and the challenges. And I'm not necessarily saying that we should, but sometimes with these long projects, you can almost get lost in them. So with this client, we have had so many challenges. There were challenges with turnover within the client's organization. We had several people come and go over this period of time, which, as you understand, can cause a lot of extra little micro challenges in there. Sometimes people leave an organization, they take that knowledge with them if it's not well documented, or they think it's well documented and it's still not super clear. And those people have moved on and someone else picks up that. Maybe you're the one who's inherited something after a person has left the organization or moved to another department, and you're trying to figure things out. So imagine that happening, and then even more turnover. So there's all these fragmented pieces to the project that can get lost and make it, even more difficult. I think that sometimes when a team is large and diverse and hybrid, it's, also another type of challenge. It's harder to bring people together. I'm not saying it's impossible, because we were able to do this with this particular client project. The team was very much like that large collective team, but smaller groups of teams. So some of the teams were in a location, one physical location in one specific geographic area, while another smaller team was a hybrid team. We've had where they're a little more polarized, whereas one hybrid team is more East Coast of the United States and one is more West Coast of the United States, and trying to navigate, communications between these different diverse teams and the large collective team can be very challenging. And on a project that is, long-term and, with all these different challenges and the diverse teams, it could really be overwhelming for some people. And this is not unique to my experience. I know a lot of you that have been through similar situations and have had to face these types of challenges. I know for me, it was very difficult. Is not even the word, but it's just something that was a very real part of the journey on this project. Another challenge that we often face, all of us, I know you can relate to this, is sometimes there's minimal detailed guidance. When there's a project that's really complicated, sometimes you can grab a hold of the vision and you understand what the outcome needs to be or should be, or what the desired outcome is. But how to actually get there in detail is a little murky, to say the least. And some team members are great with a little bit of detail. They can run with that and make things happen and really pull it together. And some people feel very paralyzed, and it's frustrating to not have the specific details. I understand both sides of this frustration coin, and these can be real challenges that we've all faced, right? This, that minimal amount of detailed guidance, having to reverse engineer a project or just kind of go off of the vision and pull it together, because sometimes you'll think you need to do this and you go down a rabbit trail and you realize it's not possible. Then you've got to pivot and go a different direction. And that can all take up even more time on a long project. So a few other things, especially my epidemiology friends, we often face challenges with access to data that we need to do our analysis or to pull the pieces together. And that can even come from seemingly, free use, publicly available data. Sometimes there can still be challenges with getting access to the exact data sets that you need. Maybe the data exists within the organization, but there are barriers to actually receiving that data and receiving it in a timely manner. Sometimes these freely available resources, depending on the population that you're really looking to seek and pull the data from, there can be additional barriers and protections in place, for that data, but it also creates a limitation and a challenge in terms of you getting access to the data that you need to complete your analysis and your part of the project. So those are some real challenges that we face. And I know that comes up quite a bit with some of these bigger projects. And then I'll just add one more, and that's, the timeline can sometimes extend far beyond what you expect. I cannot tell you how many times this has happened. So aside from the project that I'm referring to that's long-term, I've had this happen so often with our state agencies or any projects that are multi-year projects and say it's a 3-year project. And in year 1, you expect to do X. In year 2, you expect to complete Y. And in year 3, you're expecting to do Z. So when you get to year 1 and X does not get completed, then now all of a sudden you've got to complete X and Y in year 2. It gets really complicated when things come up that extend those deadlines. And then you find yourself in a real crunch toward year 3 where you're trying to do everything you were supposed to do spread out over year 1 and 2. It all comes crashing. Does that resonate with anyone? I know this is so common, unfortunately, but these things can add to the complexity of these long-term projects. But all of that being said, and even in facing all of those types of challenges, I had a mixture of those experiences across this, year plus project that I'm referring to. And now that we're about 2 months away, a little less to, wrapping this completely up, I am a little humbled by the whole experience because I realize here in a couple of things that I want to share with you in sort of my takeaways. The first thing is that, my clients are near and dear to my heart, and supporting them in this way, leading this type of project with all of its challenges and that I've just described, it keeps me showing up every day, fresh and ready. And it's because I care so much about my clients and supporting them, and I take that relationship seriously. And I think that for all of you listening, I know that, you may feel like, well, I'm not that invested in my job. But I think it may not be the exact organization that you work for that you can feel really passionate about and strongly about, but maybe it's the actual community that you're serving, who this project is representing or who it's going to be delivered to can be the connection for you that, really touches your heart and has you showing up in a really strong way every day for the long haul, of a project like this. But for me, it was my client without a doubt. And that's why we are so intentional about supporting BIPOC organizations and government agencies that are really genuinely interested in supporting BIPOC organizations, because it's going to be challenging and tough with some of these bigger, complicated projects, but it keeps us committed and showing up. The second type of takeaway here is that I realize that I'm really dedicated and committed long-term to working with my clients and supporting their mission. And again, it's that they're near and dear to my heart, but that commitment level. So when it gets tough or challenging, we're still there. We're showing up. We're going to figure it out. If we try something, it doesn't work, then we're going to, come back to the drawing board and we'll figure something else out. And when you have that dedication and commitment long-term to working with your clients, your employer, the community you serve, whatever you connect with, that matters. And it shows in your work, and it's a part of the relationship building, and it's a part of the outcome, the impact that we all want to have, which directly connects me to the third point I was going to mention, is remembering that this project is much bigger than you are. And I've pointed this out before, but I'm always reminded of this. This is way bigger than me. So how I show up, and I get to show up in this way, and I get to serve in this way, it really matters, because that impact, that positive impact, moving the needle, making a difference, is what matters most at the end of the day for me. And I think that's how my team feels as well. So hopefully this is maybe a reminder to those of you that feel a little tired or weary. Maybe you're in the middle of that long project and you're just frustrated and you can't see beyond the frustration. I encourage you to pause a little bit, think about some of the things I shared, and remember that there is an endpoint to this project. Continue to press through one day at a time. Put out one fire at a time, but keep doing the good work. I encourage you to do that because it's just bigger than you are. It's about the impact that you get to be a part of having in the community. So I hope that encourages you. All right, everyone. Until next time, have a fantastic rest of your day. Thank you for listening to the Public Health Epidemiology Conversations podcast. Visit phecpodcast.com to find the show notes for each episode and to learn how to work with me.